Hey again, Dr. Ryan here from Reach Health and Wellness Chiropractic. Today we're going to be talking about disc bulges and disc herniations. What's the difference between the two? How do we get them? And how does chiropractic help to relieve pain from those disc bulges and disc herniations? We have an illustration of a low back right here. This is the lumbar spine. These are the bones of the lumbar spine right through here. This orange thing right here is the spinal cord. Comes from the brain, goes all the way down, innervates every tissue in your entire body, so very important. The reason why we illustrated the lumbar spine and not anywhere else in the spine is because it is the most common place that we're going to get those disc bulges and disc herniations. The blue area right here are the intervertebral discs. They are the shock absorbers of the spine. They're important to keep nice and healthy. They're made 90% of water. And so as we age, we do notice that the water starts to leak out. And the reason behind that is because we become less active as we get older. And the actual discs themselves get their nutrients and water from moving. Think of it like a sponge. If we squeeze a sponge, it squeezes the water out, but if it's under a fluid, we let go of it, it sucks the water back in. The discs work the same way. So if we're not moving and that spine's not getting motion, so we get, as we get older, we get more immobile, this disc is going to thin and these bones are going to get closer together. Eventually they'll rub and they can get osteoarthritis or degenerative joint disease, so definitely something to look forward in another video there. But as we're looking at the disc here, when those two bones are getting closer together, they put an uneven pressure on that disc. So let's take a look at a top view of the disc here. So we're going to go over here and zoom in and look at the two portions that make up an intervertebral disc here. Now if we look at these blue rings right here, these are called annular fibers. They make the outer edge right here of the disc, what you see on the side view right there. And on the inside is a gel liquid center called the nucleus pulposus. It is the actual portion of the disc that acts as a shock absorber, kind of like a water bed. And so whenever we have a thinning, because there's less fluid in that disc right there, this thin right here, this uneven pressure on one end, typically we have the uneven pressure squeezing on the front right there because we're sitting a lot, causing that forward kind of flexion. It shoots that, if we squeeze that water balloon, it causes a bulge in the back right here. What that is because is this annular fibers right here start to weaken, and it allows the nucleus pulposus to push into those annular fibers. So that's what we look at as a disc bulge. Example, just looking at this illustration right here, it is starting to bulge out into the spinal cord, and when that happens, you get that really intense pain where you don't want to sit down, you can't lie down right, so you get the numbness and the tingling. It can shoot down the leg. It can even mess up your bowel and bladder function, so it can be very uncomfortable. Now, a disc herniation, which is right up in here, we'll look at this top view again. Disc herniations occur because the annular fibers here have literally been broken through and allowing the nucleus pulposus here to literally leak out right through there. It just leaks out in there and bulges right into the spinal cord there, and our spinal nerve roots coming out of these holes right here called foramen. When that happens, you get the same intense pain, numbness, tingling, all the uncomfortable things you get with this bulge, except for now you have part of your nucleus pulposus coming out of your intervertebral disc right there. So that is how we get them, and what's the difference between a disc bulge and disc herniation. As a chiropractor, we address disc bulge and disc herniations by first taking a very thorough history and then doing a very thorough exam, making sure that we don't have to send you out for any advanced imaging. And then from there, we do chiropractic adjustments on that segment there to increase disc space. When we increase that disc space, it will take that pressure off of that spinal nerve and spinal cord right there, relieving those symptoms that you're experiencing, like the intense pain and the numbness and tingling. And so if you found this video useful, please go ahead and like and share that video. And if you have any comments down below or have any questions you'd like to ask us on disc bulge and disc herniations, go ahead and comment down below. And if you have any other health topics you'd like us to cover, please go ahead and put them down there and we'll start making our next video on that. Have a great day.